How does bile aid fat digestion in pancreatic enzyme insufficiency? Imagine trying to clean greasy dishes with just soap but no scrubbing brush. Bile acts like that scrubbing brush for fats in your digestive system. It is produced by your liver and stored in your gallbladder. When you eat fatty foods, bile is released into your small intestine. Its main job is to break down large fat droplets into tiny pieces through a process called emulsification. This increases the surface area, making it easier for enzymes to work on the fats. In healthy digestion, pancreatic enzymes like lipase are essential for breaking down triglycerides, the main type of fat in your diet, into smaller molecules called fatty acids and monoglycerides. These smaller molecules can then be absorbed into your bloodstream. Bile helps by forming structures called micelles, which are tiny carriers that transport these fatty acids and monoglycerides to the lining of your small intestine for absorption. Think of micelles as little boats carrying fat cargo to where it can be taken up by your body. Now, in pancreatic enzyme insufficiency, the pancreas does not produce enough lipase. This means that even if bile is doing its job of emulsifying fats and forming micelles, the actual breakdown of triglycerides into absorbable parts is limited. Without enough lipase, fats tend to stay in larger droplets and are poorly absorbed, leading to malnutrition and greasy, foul-smelling stools. However, bile still plays a supportive role. It continues to emulsify fats and form micelles, which help whatever lipase activity is present to work more efficiently. Bile also neutralizes stomach acid in the small intestine, creating a more favorable environment for digestion. Lipase works best at a near-neutral pH, so bile's role in maintaining this environment is crucial, especially when pancreatic function is compromised. Research shows that in cases of untreated pancreatic enzyme insufficiency, fats are not digested properly, and bile acids can bind to undigested nutrients. This can cause bile acid malabsorption, worsening fat absorption problems. That is why doctors often recommend pancreatic enzyme replacement therapy. These medications supply the missing enzymes, helping break down fats more effectively, while bile continues to emulsify fats and support absorption. In summary, bile helps fat digestion in pancreatic enzyme insufficiency by breaking down large fat droplets into smaller ones, forming micelles to carry fats to the intestine lining, and maintaining a suitable environment for digestion. But without enough pancreatic enzymes, fat digestion remains incomplete. Proper treatment usually involves replacing these enzymes to restore effective digestion, with bile continuing its vital role in emulsification and micelle formation. Always consult a healthcare professional for personalized advice and treatment options.